Hello mga ka-listeners. Now we have to talk about your carbapenems. Carbapenems have among the broadest antibacterial action of any antibiotics to date. Because of this, they are often reserved for the complicated body cavity and connective tissue infections among acutely ill hospitalized patients. Actually, it is not considered also as one of the first line of drug therapy because it has a higher risk to have what? Drug-induced seizure. Take note that it is one of the serious adverse effect related to your carbapenems. Now we have your ME. How can we know that they are one of the carbapenem drugs? Now E stands for ertapenem. Actually, carbapenems have penem in their names, like your ertapenem with a brand name of Invans. We have also your meropenem with a brand name of meronem and merem. Actually, they are common forms of your carbapenem. Imipenem plus cilastatin with a brand name. Actually, the combination form of carbapenem with a brand name of permaxin and TNM. What is the role of your cilastatin there? Your cilastatin, actually, it is a unique drug that inhibits the enzyme in the kidney. Actually, there is an enzyme specific enzyme that is located in your kidney, that is your dehydropeptidase. Your dehydropeptidase is the one that quickly breaks down the imipenem. So to prevent the breakdown of imipenem, we need the help of your cilastatin. Now, via inhibiting the dehydropeptidase. Another work of your cilastatin is that it also blocks the renal tubular secretion of your imipenem so that the imipenem cannot be excreted immediately by the kidney. Take note also that your meropenem is very active to the gram negative kind of bacteria, such as your Pseudomonas aeruginosa, that also causes your Pseudomonal infection. Very good. Your meropenem, take note that it is the only carbapenem currently indicated for the treatment of bacterial meningitis or the infection to the meninges. Another thing is your sulfonamides. Now we have to talk about your sulfonamides. Your sulfonamides, actually, it is also called as your sulfa drug. Actually, they are derived from the sulfanilamide, a sulfur-containing chemical. Now, why it is called sulfonamide sulfa? Because it has a sulfur component type of antibiotic. Actually, they are drugs that also inhibit the folic acid synthesis. Okay, the folic acid, um, if we will relate this to the bacteria, the folic acid is needed. They are very needed or very important for the DNA synthesis and also for the RNA synthesis. We know the fact that DNA is very important in our cells and also in the bacterial cells to perform a normal cell division, because without the presence of the DNA, then bacteria may die. In humans, the folic acid, we cannot synthesize folic acid, and we depend on the folic acid or folate, also called as your folate, that is found in our diet just to obtain this essential substance. Actually, the other function of your folic acid, if you will relate also with the pregnancy, it is very important to prevent neural tube defects, taken usually 400 micrograms daily. And your sulfonamides, it is also considered as your anti-metabolite because there are series specific step among the series of steps for the biochemical pathway that is also needed for normal cell division. So once a specific drug obstructs or blocks specific steps in the biochemical pathway, then it is considered as an anti-metabolite, such as your sulfonamides. So that is your anti-metabolite. Beyond it has a mechanism of inhibiting the folic acid. It has also a mechanism to block specific steps in the biochemical pathway or the biochemical activity or processes, which in turn it can lead to um, alteration to the normal cell division. So that is your antimetabolite. Now, what are the examples of your antimetabolite? We have your sulfonamides, your sulfoxazole. Next is your sulfamethizole. We have your sulfasalazine. Actually, they are available as single drugs, given as PO or per orem or for oral use. We have also your sulfamethoxazole. It is actually co-formulated with your trimethoprim. Actually, it has an abbreviation of your TMP-SMX. Okay, what is the role of your trimethoprim? Actually, it blocks a specific enzyme required for the bacterial folic acid synthesis. That specific enzyme is your tetrahydrofolate reductase. So, kung wala itong tetrahydrofolate reductase, so hindi na mabubuo yung folic acid. Kapag hindi mabubuo yung folic acid, hindi rin mabubuo yung DNA or yung RNA which is needed for cellular division. Then later on, pag hindi nabubuo yung DNA, then bacteria may be compromised, leading to bacterial cell death. So that is the mechanism why it is co-formulated with your trimethoprim. Actually, we have another forms of sulfonamides, topical form. We have your silver sulfadiazine and mafenide acetate that is given for burns. We have also your sulfonilamides, that is as vaginal cream and suppository that can be given to those patients with problems like in their reproductive system or organs affecting the vaginal part. We have your inflammation of the vagina known as your vaginitis. And we have also ophthalmic preparation or your ophthalmic sulfacetamide that is given for superficial ocular infection. So those are actually your sulfonamides. Uh, what are the other things that we need to consider about your sulfonamides? Okay, what are the adverse effects of your sulfonamides? Do you have any idea? Actually, the adverse effects of the sulfonamides, they include GI effects. Actually, most common GI effects as your nausea, vomiting, diarrhea, abdominal pain, anorexia, and also stomatitis and hepatic injury, which are all related to the direct irritation of your GI tract. And also, it has a dermatological effects when you take the sulfonamides. Uh, one of the adverse effects is that it causes photosensitivity. Again, photosensitivity. So I think those are some of the common points that we must have to remember about the adverse effects related to the sulfonamides.